everyone, welcome back to the episode of Ask Dr. Nick. My name is Dr. Nick Schmidlkoffer and I work for the Neurologic Wellness Institute. And on today's episode, we're going to answer the question, does physical activity prevent severe COVID-19 outcomes? And the article we're going to discuss basically talks about just that, on how being more active can prevent people from going to the hospital, going to the ICU, or even death from COVID-19. So we're going to get right into the article and talk a little bit about the abstract and just the study in general. And so this article, again, it's called Physical Inactivity is Associated with a Higher Risk for Severe COVID-19 Outcomes. A study was done with 48,000 people, adult patients. The objective was to compare hospitalization rates, intensive care units, mortality for patients in COVID-19 who were consistently inactive, doing some activity or consistently meeting physical activity guidelines. With these patients, they took 48,000 patients, 48,444, 40 patients with COVID-19 diagnosis from January 1st, 2020 to October 21st, 2020. So it was just, an almost 10-month measurement. And then what they did was, because in California, they require them to rate physical activity. So they linked that with at least 3 exercise vital sign measurements from either March 2018 to March 2020. So in California, they're required to kind of say what their physical activity is like. And at doctor's appointments, they just kind of do that. And so the categories were either like consistently inactive from 0 to 10 minutes, some activity 11 to 149 minutes per week, or consistently meeting guidelines, which is 150 plus minutes per week. And they were asked basically on 10-minute increments, like, do you have 0 minutes, 10 minutes, 20 minutes, 30 minutes, 50 minutes of activity per week, or so on and so forth. And then what they found here is the results. Patients with COVID-19 who were consistently inactive had a greater hospitalization, greater admission to the ICU, and death due to COVID-19 than patients who were consistently meeting physical activity guidelines. So basically, ones that were just 0 to 10 minutes per week were way worse than those that were meeting guidelines of 150 minutes or more per week of exercise. They also found that patients who were consistently inactive, so the ones that were just from the 11 to 149 minutes, also had a greater risk of hospitalization, admission to the ICU, and death than the patients that were consistently inactive. So the ones that had less than 10 minutes of activity per week also were consistently greater risk of hospitalization, ICU, or death than those who were just doing 11 to 149 minutes per week. And conclusions, again, consistently meeting physical activity guidelines was strongly associated with reduced risk for severe COVID-19 outcomes among infected adults. Okay, so what we want to do here is they have a few graphs we want to look at, right? So when we think about a study like this, we're always looking at, there must be some other attributing variables to physical activity. Obviously, young people might be more active than older people, and so therefore, if young people are more active, then they're also young, so maybe that's why they're not having severe outcomes, right? And so that's why they obviously took and they compared all these adjusted variables. And so they had almost 7,000 people in the consistently inactive group. They had almost 38,000 or over 38,000 people in the some activity, and about 3,000 in the consistently meeting guideline group. So obviously more people were doing the some activity, okay? They have all these different rates when it comes to age, gender, race, ethnicity, BMI, smoking, different comorbidities, which is obviously important to look at as well. And so let's come right down here with these demographics. And so here they have a beautiful graph that kind of shows these different odds rate or adjusted risk factors odds ratios. So one would be that it's basically equal to the consistently active group for 150 hours and 150 minutes per week of exercise. And so if you look here, people were more likely, as it's over 1, more likely to have hospitalizations if they were consistently inactive, okay, right there, consistently inactive at exercise level, than all these other risk factors, right? Like hospitalizations with emergency visits, pregnancy at the time, cardiovascular disease, renal disease, cancer, metastatic cancer, hypertension, diabetes. Okay, consistently being inactive had a worse risk than all these other comorbidities. Okay, at the same time, now what they did find was that age was a greater risk factor. Also, having an organ transplant was a greater risk factor. So those two were a little bit greater than the physical activity versus inactivity portion. So, and they found that for all of them. So this one is going to be for intensive care unit. Again, consistently inactive was worse off than most other diseases, but of course, aging or high age was a more of a risk factor for severe outcomes, specifically being in the intensive care unit. And then lastly, death was again being older, more likely to die from COVID-19, and say having an organ transplant ever, more likely to die from COVID-19 than being consistently inactive. But consistently inactive was still high up on that list. Okay, and so what they do talk about here is that basically in these main findings, right, this largest healthcare system does collect physical activity data in California, right? And every outpatient encounter with the healthcare provider. So looking at that magnitude of risk for all outcomes associated with being consistently inactive exceeded the odds of smoking virtually all chronic diseases like the hypertension, the diabetes, the cardiovascular disease. Study in the analysis indicating that physical inactivity may play a crucial role as risk factor for severe COVID-19 outcomes. And again, somewhere in this study, they also show that the only exception to that, right here, other than advanced aging or other advanced age and history of organ transplant, physical inactivity was the strongest risk factor for severe COVID-19 outcomes. So if we come back to say, like, what can we do to help prevent us from getting sick and going to the hospital following COVID-19, or maybe even other virus and viral illnesses, physical activity may be one of the best things we can do. Again, 150 minutes per week is really not that much. That's a 30-minute walk 5 times, right? 30-minute walk 5 times a week, that's 150 minutes per week. And so if you can just get outside and go for a 30-minute walk, that might be a 1.5 mile, a 2-mile walk, depending on your exercise value, that can be more beneficial for preventing these severe COVID-19 outcomes. So please get outside, be physically active. Obviously, of course, eat healthy, having nutrition, we can't deny that, but definitely get outside and be a little bit more active. So if you have any questions or comments, please leave them below. If you have any suggestions for future topics, I would love to hear them. Thanks again, and have a great day. Stay healthy.